Hello, everyone, and welcome to Inside HealthCare. A new Minnesota study reports that the numbers of deaths from drugs such as heroin are down for the first time since 2010. Yet the report is of little comfort to the 102 families who sadly lost a loved one to drug overdoses this past year. One local mom, Lori Lewis, contacted us about her heartbreaking loss. Last July, her 23-year-old son died from a heroin overdose. She never dreamed that this would happen in her family. Now she's speaking out to warn other families. She will be talking with us shortly here in the studio, but first, our cameras caught up with her as she spoke publicly to students and parents at Tartan High School in Oakdale recently.
Some of you here tonight may know me and my family. You may be a teacher here at Tartan and you've had my kids in class. My husband may have coached your kids in sports, and your kids may be friends with my friends, or with my kids. We may be friends, neighbors, co-workers. We've chaperoned school events together and shared stories at numerous sporting events. Never would I have thought that I would be sharing Ryan's story with you tonight. But my husband and I, along with our children, feel that if we can help one family or individual, then we'll share. On July 10th of this past year, my son Ryan died of a heroin overdose. He struggled with the disease of addiction for a year to a year and a half, an addiction that began with opiates and moved to heroin. Ryan so very much wanted to get better. When I asked him what was so hard and what I could do to help, he just said, "Mom, the physical and psychological cravings are just unbearable at times." And this was even when he was on the monthly Vivital injections that are supposed to help reduce cravings. It was around the end of May when I suspected Ryan had been using again, and we confronted him. He had been slipping on his meetings and did not want to continue attending day treatment, and we were right. As parents, we were at our wits' end, exhausted, and in need of help for our son. Again, he went back into Hazleton at the beginning of June. This time we told Ryan that what we were doing at home was not working, and on the advice of his counselors, he would need to move into a sober house when he discharged. He was extremely angry at both of us and didn't talk to us for about a week. When he and my husband did talk one night, Ryan said, "Dad, am I ever going to get better?" And Monty said, "Yeah, we're going to get through this together, buddy. We can do it." On Monday, July 7th, my husband picked him up from Hazleton and helped him move into a sober house in St. Paul. He was still very angry with us about the situation and decided not to talk to us that day or night. So we gave him time, and on Tuesday he called. On Wednesday, I went to go pick Ryan up after work, brought him some clothes and bedding, and we went grocery shopping. We talked about how things are going to be and made plans for the next day. I gave him a hug and a kiss and told him I loved him and how good he looked. On Thursday afternoon at 12:30 p.m., I received a call from a man who identified himself as a St. Paul police officer and asked if he could come to my work and talk to me. "Why do you need to come to my work and talk to me? What's going on? Why can't you just do this over the phone?" My mind started racing. I thought, where's my husband? Where are my kids? Where's Ryan? It couldn't be Ryan. He's in a sober house. He's safe. I then just asked him if it had anything to do with my kids to please just tell me. He then told me that my son Ryan had overdosed that morning. Well, what did this mean? Ryan had overdosed before. I asked him again, not wanting to hear the answer. He then told me that my son was dead. He had died that morning of a heroin overdose. And I remember just screaming no over and over and over again, because this is not how it was supposed to be. He was supposed to be in the sober house, in recovery, and safe. We were supposed to work through this together. The officer met me at my car. They told me they had already talked to my husband and gave me as many details as they could at that time. On the way home, I was in shock. My phone rang and rang with my husband trying to reach me, but I just could not talk to him and hear his voice. This wasn't the way it was supposed to be. Ryan was supposed to be in recovery, get the job of his life, marry the love of his life, and celebrate all of those first. He was robbed, and we were robbed. And there's such a void in our lives now. We miss him terribly. As parents, we feel that we failed. We could not protect Ryan. I keep telling myself that there has to be a purpose in Ryan's death and all of our suffering, but I just don't know what that is yet. What I do know and what you've heard tonight is the face of addiction has changed. It can be any one of us. And no longer can we say this will never happen to me, because it can and it does. No one chooses to become addicted. The person chooses to use that first time, and that drug chooses them. We as a community can recognize this, educate ourselves, and support people that suffer from this disease just like we support someone who has diabetes or cancer or any other many chronic diseases. This brief period in my son's life was not what defined him. Ryan will always be remembered as the funny, talented, creative soul that he was, and he would have done great things. Thank you.
And we're very pleased to have with us Lori Lewis. Thank you so much for being with us. From all of us here, our hearts really go out to you and your family.
Thank you.
This cannot have been a very easy time for you. Can you tell us a little bit about your son?
I can. Ryan was a very energetic, unique individual. He was very talented, very creative. He had a passion for the arts, photography, music. He excelled in those areas. If you ask anybody to describe him, they'll say he just was very present. You knew when Ryan was around. He was always trying to, tell a joke, get a rise out of you. And again, that high energy. He loved painting, taking pictures of friends, nature, was always up at the counter drawing in his books, creating music, sitting on the couch playing his guitar. You knew Ryan was there, and whether he was angry or excited or happy, you saw him, you heard him, you felt him. So it's huge void in our lives and for anyone he touched.
I cannot even imagine. So you contacted us, said that you wanted to get the word out to other parents that you never thought this would happen to your family, and why is this so important, and what is the message that you want others to hear?
I think the most important thing is for parents and families to be aware that specifically this drug heroin is in our communities. It's a wicked drug, and it doesn't start out as being heroin. It can start out with people using opiates, painkillers for a simple dental or medical procedure or for recreational use.
That's what I heard, yeah.
Can turn into a full-blown addiction. And I think, again, to stress the importance that this is in our community. It's just a text, a tweet, a phone call away. Our kids have all this technology and communication in their hands, and it's just scary that, you think it can come in from anywhere right to your doorstep. And it's terrifying. And we just want other parents to understand that, it's out there. It's not I thought it was, somebody who was homeless that lived on the streets, in Minneapolis, and it's not. It's, athletes, it's student council kids, it's, your next door neighbor, it's people we work with, in our churches and our parks. And just to be aware and to reach out, if you suspect this or, need help or need support, and but it's here.
As we saw at the top of the show, that you are publicly speaking out, taking part in Washington County forums, joining other organizations, Washington County Attorney, the Sheriff's Department. Can you tell us a little bit about those forums and why you've decided to join in that effort?
Sure. For us, again, we were caught off guard, and for us, we continue to fight for our son. And again, we want to bring awareness to our communities, but I think it's important, again, for parents to hear from the Washington County Sheriffs and law enforcement and the DEA in our area, and to actually see the statistics. it makes it real, and to know what's happening out there and to learn about what our kids already know. And also to talk about prevention and just awareness, and educate people in our community on what's going on, and if you suspect this is happening, where you can get resources and where you can get help, to help not only your loved ones, but to also help yourself and get the support that you need.
Has it been healing to take part in this, or is it just so painful and difficult? I don't know.
It's both. You know, it's very painful for what our family's going through, but again, we feel that for us, bringing awareness, and if we can just touch one other life by sharing Ryan's story, that's enough to keep us going and helping in any way that we can.
What kind of reaction are you getting from parents or from students when you're out there?
Very positive. I mean, everybody comes up after the forums and, you know, expresses, you know, their sympathy and, you know, the thank yous. And it's amazing at how many people are touched somehow in their lives, whether it's a child, a family member, you know, a friend. And they say 1 in 3 families are affected by this, and that's huge. So a very positive response.
So if someone's listening to us talking right now, and they have concerns, what kind of advice would you give them?
Oh, go ahead.
No, go ahead.
I think as a parent, the one thing I would say is trust your intuitions and your gut. If you know your children the best, you know, our children's health and well-being, we need to protect that. And kids are going to make mistakes, and, you know, we're here to guide them. But if you do suspect it, start the conversation. Don't turn a blind eye and think it'll go away, because it won't. And specifically for heroin, if you do find out that is in your home, again, take action. The one thing that I wish we would have done differently is gotten Ryan into treatment sooner. Would it have changed the outcome? I don't know. But also to get support for yourself. You know, there are enough support groups out there, and that is much easier said than done. It's so very isolating, and the stigma that goes along with it is enough to keep it very private. But definitely seek help from any of the organizations. Know the truth. You know, contact your school counselor if you don't know how to start that conversation with your kids. There's so many resources and tools out there right now. And again, trust your instinct as a parent, and it doesn't have to be a full-blown intervention. I mean, it can start with a conversation, and, you know, just to let your kids know, you know, this is what I suspect, this is what I think. And we did all that, you know, and we tried, and you need to continue trying.
It's good to know that there is treatment available, and there is help, and there is support, you know, but I can't imagine, like, if all of a sudden you have concerns, you probably don't know where to turn. So that's good advice. I would appreciate that, yeah. So final comments for those that are watching us today?
I just think that, again, when you find this out as a parent, you're first at shock. You don't believe it. And, again, just reach out, start that conversation, turn to whoever you can for resources. Don't isolate, because you do need support from many different people.
Well, Lori, really, it's been a pleasure to have you with us, and your strength and courage is very inspiring and very helpful. So thank you so much. Really appreciate that.
Thank you.
Thank you. We'll take a short break, and when we come back, a local doctor tells you what you need to know to help save a life. It could be yours. Stay with us, everyone.
Mom was diagnosed with Alzheimer's at 58 years old.
For me, it was heart-wrenching.
It takes a toll on everyone. I mean, it's a depressing disease to watch unfold before your eyes.
You just don't see the person's soul's like gone.
This disease just ravages a family.
It changes your life.
The magnitude of it is indescribable.
Now is the moment. If we work together, we can stop this epidemic.
Contact Bright Focus and learn more.
Welcome back to Inside Healthcare. Now we turn our attention to strokes. May is National Stroke Awareness Month. Strokes are still the third leading cause of death in the U.S. More than 140,000 men and women die each year from strokes in this country. And we're very pleased to have back with us Dr. Paul Shanfield, a leading local neurologist, and Tess Zerzant, a clinical nurse specialist. So thank you both for being back with us. I think it's been a couple of years since you were with us. And at that time you were expressing concern about a growing trend of too many people with stroke symptoms either not calling 911, but just taking themselves to the hospital or having a family take them to the hospital. Why is it so important to call 911 when you first sign of those stroke symptoms? Doctor?
Stroke is a major public health and medical health crisis, really, at this point, a major problem in America. There is clearly now a treatment for stroke, and it is the only medical condition, really neurologically, that we can actually reverse damage to the brain. So you can have damage, and we can actually reverse it. But the treatments are time sensitive. So you must get there quickly. Less than a third of Americans get to the emergency room on time for a stroke. And the treatments are safer and better if they're given within 3, 4, 4.5 hours of a stroke. So it's extremely important we get there. Probably about, the last numbers are about 5% of people with strokes in America actually come and get treated for a stroke, unfortunately.
Wow, that is staggering to hear those numbers and statistics. So what exactly is a stroke? What happens when you're having a stroke?
Today we're talking about the most common cause of stroke, which is a blood vessel that's blocked by a clot, and part of the brain loses circulation and dies then. The less common cause of stroke is where a blood vessel ruptures and there's bleeding into the brain, and we'll leave that for another day, if you will. So the ischemic stroke, it's called, where it's essentially a heart attack of the brain, where a blood vessel closes off, you lose circulation to the brain, and part of the brain dies. The signs then are part of the brain that suddenly stops working. Our problem getting people to the ER is that this often does not hurt because you don't typically get any pain from the brain itself causing trouble. The brain recognizes pain in other parts of the body, but it itself does not have nerve endings.
Because there's no feeling in the brain, right? Or
yes.
Nerve, yeah.
It's fascinating. I've watched neurosurgery where you can open up the skull, and that hurts, and then you can wake up somebody, and you can put electrodes in the brain and decide what to do, and people are awake and they don't feel anything. It's remarkable. So since it doesn't hurt, and it may be a sign that's not devastating, sometimes people don't come in then. I mean, a devastating stroke, paralysis completely on one side, your speech goes, you can't see to the right. It's pretty straightforward, and people usually call an ambulance. But if it's less than that, they often kind of wait. Well, my hand is numb and my face is droopy, I'll just kind of wait a little bit. Maybe it's fell asleep on it, my hand was falling asleep or something. Or, the speech was slurred and maybe I was tired, or you got a lot of excuses. But unfortunately, those can be signs of a stroke that may worsen in the next minutes or hours, and if you don't get there quickly, you lose the chance to recover from the stroke.
What are those symptoms that people should be recognizing, and how do you know when you're having a stroke?
Like Dr. Shanfield said, I think some of them are really obvious. And so if somebody has weakness of the face or the arm and the leg all at once, it's something people would recognize very, very readily. It's sometimes the more subtle things, and a good way to remember them is, yes, I do have a little chart, is to we use an acronym called FAST. So it not only helps you remember the signs and symptoms, but it helps you be reminded to act fast. So F is for face. Look to see if the person's face is unequal, if there's a droop, if part of the lip is drooping down or the face just doesn't look even. Ask the person to raise both their arms. So A is for arms. Ask them to raise both their arms up and see if one has some weakness or inability to move like the other one. So looking for differences from left side to right side. And then S is for speech, and a lot of strokes, but not all strokes, but many strokes will affect speech, either the way we express our speech or the way we interpret it. So somebody can be coming across as very confused, for instance. So I might be speaking to you, and you might be nodding your head, but not...
And you sound okay to yourself usually?
You sometimes can sound okay to yourself. Sometimes you can't or you don't. But other times you might be saying words to yourself that come out like mumble jumble to everybody around you, but they sound okay to you, and you're thinking, why don't people... We have patients who have told us, why didn't they understand what I was trying to say? So there's a lot of varieties of that, but if speech is affected in any way, that's definitely a sign. Another one that we see sometimes too is dizziness. That's not on here.
Oh, interesting.
And that's a tough one. That's a challenge.
Well, that could be so many things.
Exactly right. Exactly right. So that's a challenge, but I think a key word for people to remember is sudden. So if it starts very quickly like that, that's a cue that time, call 911.
And it's on one side or the other?
The dizziness is usually more of a general feeling. Okay. So it's not one side or the other. The weakness or a numbness even of one side of the body or the other is something we'll often see.
And this is if you're home alone, maybe get by a mirror or something, that would be helpful?
You could certainly do that. Sometimes the person can feel it themselves. They know that when they're trying to move their face or talk, that it's not coming out right. There may be that awareness too.
And do you find like it's loved ones or friends that are recognizing it before the person sometimes?
Oftentimes people around will be the ones to say something isn't right with him, or I think a lot of times we don't want to admit that something is wrong with us, so it does take another person to say, hey Jody, something's not right with you, I'm calling 911. Doesn't matter how old, how young, everybody, 21-year-olds, 57-year-olds, 80-year-olds, little babies can actually have strokes too, depending on their conditions. So age is a factor. There's certain ethnicities that are more at risk for strokes. African Americans, for instance, Hispanics are higher risk for strokes. So there's some things we cannot control. But other risk factors that we can keep an eye on and have control over, those are the ones where we as a person can make a difference. Blood pressure, gigantic. And diet, I think, can make a difference too. I think the sodium for some people can really be a factor that contributes. Not for, there's not a prescription for everybody, but I think we have to look at ourselves as individuals and say, do I have high blood pressure? Am I sitting on the couch more than I'm up out going for a walk after supper? That type of thing. So how
sedentary kind of a lifestyle.
Exactly right. And I think the websites for the stroke organizations have places where people can go for looking at their risk factors and evaluating those in more depth.
And you were mentioning about the effective treatments. Maybe you can just touch a little bit. I know there's a lot out there, but it's very exciting that there are these treatments now available that can reverse. That's just amazing to think about. It can reverse the effects of a stroke.
Yes, the first one I mentioned, which is approved by the FDA in 1996, is intravenous TPA, or it's a clot dissolver or a clot buster that we inject intravenously. Again, it's time sensitive. You have to get it in within 4.5 hours of the onset of the stroke, and then it may dissolve the clot and things will be much better. if it's too late, you may bleed into the brain and therefore have a bad stroke become terrible.
Oh, wow.
Now, there is another dramatic treatment, although it's not FDA approved yet, which is going in through a catheter and doing like a heart cath, like they do for a heart. They open up a clot or put a stent in to open up a vessel to the heart and stop a heart attack. We can do that now with stroke. There are 3 big studies that were just published this spring that show that this is effective. Again, time sensitive. You have to get the blood flowing to the brain before it gets permanently damaged, but you can get that in and do it quickly. And finally, once you've had a stroke and are in the hospital, it turns out that wonderful nurses like Tess on the wards make a big difference. Good health care in the hospital, good nursing care. So you should go to a program that has a hospital that has a stroke unit or a neuro unit, because it turns out that if you spike a fever or you aspirate and get pneumonia or you get a urinary tract infection or you lay in bed too long and get a clot in your leg, all those things will interfere with the improvement of brain cells that are trying to recover from a stroke. So it turns out you do better with better health care, with
Which
better
makes
nursing
sense.
care.
Yeah.
Who knew?
Yeah. And then just quickly, you're still with St. Joseph's Hospital?
Yes.
And the Health East Neuro Program?
Yes, definitely.
So final comments, wrapping it up here. What do you want our viewers to know about preventing, treating, surviving stroke?
Well, so I would say there's probably 3 things, if you will. One is, please do a healthy lifestyle. I had a 92-year-old lady who I said, well, how'd you get to 92? She said, you move your butt. You sit, you're dead. So move, watch your diet. As Tess said, try to take less saturated fats, try to take less sodium, if you will. Cholesterol is now an issue that we won't address, but saturated fats are clearly a problem. And then if you have a symptom, please call 911. Don't just think about it or wait to see if it goes away or have your husband or your wife drive you to the hospital. And finally, don't do anything else. Just call 911. Don't take an aspirin like you do with a heart attack, because if a stroke may affect your swallowing and that aspirin may go right into your lungs and you may get pneumonia. So don't do anything but call 911. And before that, move your butt. Live a healthy lifestyle.
Tess, final comments?
Well, I think Dr. Shanfield said it pretty well. And know your risk factors and seek information. And because we can do things about it, it's not as frightening as it used to be. And I think the more proactive we are in saying, ooh, this could be happening to me, and do something about it, the better our chances for going back home.
Well, it's always great information. Thank you both. I know you have very busy schedules, so thank you for taking time to be with us. Appreciate that.
Well, thank you for getting the word out.
Yes,
absolutely. Thank you. And we'd like to thank you for joining us. We hope you join us next time on Inside Healthcare. We'll see you then, everyone.